go through taking a patient and admitting them. So basically the paperwork that you want. So I have a dog, her name is Autumn. So first thing you want to do is make sure that you have their signalment all down. So you want to make sure, A, it's a dog, is it a female, is it a male? For a male, is it spayed or neutered? How old? Make sure you have the breed correct, and just so that you're sure that the dog is indeed the one that you were supposed to have. So, and the other thing is, like, make sure the birthday, you want to make sure you have the correct weight. Okay, so you want to make sure you know that they're here for a dental, which doctor is performing it, a good phone number to call them in case of emergency or anything. And then after, so you want to give them an estimate of everything that you will be doing, just so that they're not surprised, that they have a good idea of what's going on. And then the most important thing is make sure they sign it to verify that they were okay with what you gave them. Verify the signalment, and then you get your estimate signed. The next thing to do is to verify if they have any medical issues or not. This dog does not. All she has is some arthritis. She's an 8-year-old beagle, so that shouldn't cause any issues. So, and then the next thing is, so we have our records on our computers. So this dog's only been coming to us, but if they have went anywhere else or have medical records with them, you want to definitely get a copy so that you have the full medical record with you. Next thing is you want to verify they've gotten recent blood work. So this dog about a month back got a full wellness CBC chemistry, in which that was completely normal. So that just verifies that the kidneys and liver will be able to handle the anesthesia. Next thing you want to do is make a cage card. So same thing, make sure you double check that the labels with the name and breed and weight and all that are all the same on every paper. Put their emergency contact number on here. Any kind of aggression or warnings or anything you definitely want to put on here. The anesthesia sheet, you want to write down what profile to just make sure that you have the fluid rate that the doctor wants during anesthesia, the proper induction drugs, all that figured out beforehand and written down on here so that it's all in one spot, everyone's on the same page. And then once the actual surgery and all that is all over with, you know, even with general hospitalizations, you send home a discharge instruction sheet. So prescriptions, it will have any drugs that you're going to send home that will have the instructions on there. So this dog had gotten a fourth premolar extracted, so they gave buprenorphine injections. So the dog currently is not on any medication, so there shouldn't be any reactions, you know, with other drugs. But if there were any drugs on board, you want to make sure that there's nothing that can cause issues. And then just warn them that, you know, they could be a little more drowsy than normal because of the pain medication. But otherwise, it's going to go through just saying that they did have that tooth extraction. They got the pain medication already, so that there's no further things that they have to give. They just want to show just things to look out for, like loss of appetite, vomiting, lethargy, weakness, any kind of vomiting or diarrhea. In that case, you want to either contact us or go to emergency if we're not here. Also, to expect grogginess in general from anesthesia, and that, you know, feeding and drinking may be a little less, but you definitely still want to try to give them some food. But otherwise, that is a pretty much overall view of hospitalization. Patient, you want to either write down on the cage card a unique thing about them that, you know, makes it to where you can verify that is them. Or a lot of hospitals, what they do is they have paper collars that they can write the patient's name on it, so that they have no chance of mistaking the patient. So whichever way the hospital does it, you just want to make sure that the right animal goes under anesthesia for the right procedure. Different blood drawing positions. So the first one we'll go through is jugular. So what you want to do is hold the patient's nose and kind of hold their head in an angle like this, and that makes it to where the neck is nice and wide open for the person drawing the blood. Next, we'll do our cephalic vein. So say you're doing this one, you want to take the leg and then kind of roll and press, and what that'll do is that'll occlude the vein to where you can properly draw the blood. And then for the saphenous vein, that's the vein right down here. What you want to do is take your pointer finger and your thumb, and you're going to hold like this, and what that'll do is that'll press on the vein to where it will occlude it enough to where the person drawing the blood can get it. Properly put a patient in the cage, what you want to do is set them in there. Make sure that you have a hand on them to where they won't jump out, and then shut the door. And then to get a patient out of the cage, you want to unlatch the door, make sure you have a hand on them, and then grab them and make sure that there's suction to your body so that you know that you have a good grip on them, that they're not going to jump out and things like that. To apply a muzzle, if you look at our muzzle, the short, small top part goes on the top. So what you do is you grasp both sides and then you just place it right over their nose. And what you want to do is make sure their ears are not in it. You want to make sure that you tighten it, and that'll make it to where you know that the muzzle is on properly and that the dog's not going to be able to open their mouth very much to bite you. And apply an e-collar onto a patient. What you want to do is take the e-collar, you want to size it. So, and then after you size it, make sure that you just put the clips together. And the goal is to make it to where the dog's nose isn't going to go past the edge, because if it is going past the edge, then the dog can still lick. But otherwise, that is all you have to do to apply the e-collar. We're going to start our physical exam on a canine. So first, what you want to do, you want to look at their eyes, see if there's anything abnormal such as discharge, redness, and then go to the teeth. So she's missing a lot of teeth, so that would indicate she's had dental disease in the past. So nothing too bad right now. There's not a lot of tartar or anything. You want to make sure there's no lymph nodes that are enlarged. And then what you want to do is kind of like a full body feel, just to feel for any lumps and bumps. So right now I'm kind of feeling there's like, it feels like a mammary tumor. It's not terribly huge, but so you just want to keep an eyeball on that just to make sure that it's not getting any larger. I'm going to check her ears, which they don't look terribly bad. Maybe a little bit of wax. We're going to look at her rear end just to make sure nothing bad is back here. The lymph nodes are good. So she looks pretty healthy so far. The next part of your exam should be a TPR, just to make sure like her heart, lungs are doing good and her temperature is normal. You put lube on your thermometer. So her temperature is 99.9, and that is totally normal. The next part of the physical exam is the listening to the heart and the lungs, so using a stethoscope. So what you want to do is listen for about 15 seconds and get a heart rate. So I got about 120. So what you do is you take, so I got 30 in 15 seconds, and what you do is you take that and times it by 4 to get the heart rate per minute. And then we're going to continue to listen to the lungs. So when listening to the lungs, you want to make sure you're not hearing crackles or abnormal sounds. Overall, she's a pretty healthy looking dog. The ASA score I would give her is like a 1 or a 2. There's not much that I'm finding that would give her any kind of disease. The only reason I say 1 or 2 is because she's a 10-year-old dog. But overall, pretty healthy looking dog. So we're going to do a physical exam on a cat. So first you're just going to look over like the ears, the eyes, nose, same kind of thing like you did with the dog, just to make sure there's no infections or abnormalities, which her eyes and her ears look pretty good. Now with cats, you're worried about resorptive lesions, so you want to take a peek at their teeth. So she's got a good amount of tartar, so she's probably going to be needing a dental, just to make sure that none of the teeth are broken or anything. So next, you're just going to feel, make sure you don't feel any lumps or abnormalities. So you can see she's got some like thin hair on her dorsal spine by her hips. So she may have some kind of allergy to something in the environment. But so next we're going to do a TPR. So for the temperature, so we got 99.8. So we got 99.8, which is totally normal. Next we're going to count her breaths. We use the stethoscope to listen to her lungs too. So let me count her breaths first. So you're going to count however many breaths in 15 seconds and then times it by 4 to get per minute. So I got a total of 5, so that's 20 respirations, which is normal. It's a little high, but she's a little nervous. So next I'm going to listen to her lungs, make sure it sounds good. So her lungs sound totally normal. There's no wheezing, no crackles, no anything like that. So next we're going to do a heart rate. So I'm going to use the stethoscope for that. And at the same time, you're going to listen for arrhythmias, any kind of murmurs, anything like that. So I got a total of 45 in 15 seconds, so that's about 180, which she's anxious, so that's normal for a cat to have a pretty fast heart rate. And I didn't hear any kind of murmurs or heart abnormalities. I'm going to give her an ASA score of 2 just because of the hair loss on her rear end and then because of the dental tartar. Overall, she's a pretty healthy cat, but those 2 areas just need to be taken care of. Alright, so we're going to do a jugular blood draw on this dog. So you want to hold off at the thoracic inlet.
I gotta look around.
Stretch it out.
No. No. Yeah, and I was like, how are you so flexible?
And then you want to make sure you hold off just so that it doesn't bleed afterwards. Alright, so we're going to do a jugular blood draw on a cat. So you want to hold off in the thoracic inlet just like with a dog. And once you feel it, and then same thing, you just want to hold off just cephalic vein blood draw. So first you use your alcohol. And then once you feel your vein, you're good to pull. And if you can see, Alyssa is holding off for me to get a blood draw from the cephalic vein of the cat. So Peyton is holding off right now. So
Come on, buddy. Okay. Let's get it ready to start. Come on. Come on. You can do it. Come on, buddy. Up here. Come on. Come on, Hendrix. Come on, buddy. Oh, good boy.
take.
Here we go. Good
Once
job,
you find your
Hendrix.
vein,
I'm not sure about stables. Good boy, Hendrix. You're a good boy.
So you're just gonna
Stay. Just stay. I just have to look at your ear. You're a good boy.
and then yeah, pull back as much as you need. Draw blood from the saphenous vein of a dog. So I'm gonna put some alcohol in there. Alright, so once you find your vein, it's gonna be the same thing. You just go right under the skin. Wiggly vein. And then you just pull back until you have enough for what you need to run. We're gonna do the saphenous blood draw on a cat. So what you want to do is, so Diana's holding off by pushing down on the leg, and then we're gonna put some alcohol, and then so once you get a good visual on the vein, you're just gonna go just right under the skin. And then if you can see, it's got a good vein, so it made it nice and easy. But and then however much you need, you pull. Databases for any animal is the PCV, the total protein, the glucose, ALT, and the BUN. The hospital that I'm working through, the only additional pre-surgical blood work that we have is a hemogram or a CBC, and the ALK phos and the creatinine. If you were to have a sick, injured, or a geriatric patient, the additional tests you may want. So if you're seeing a patient that maybe has pancreatitis, a CPLI would be a good idea. If their legs are sore, you don't know if it's broken or just strained or whatnot, you could do an x-ray. If they are having spells of passing out, you could do an ECG. If they're pale, you could do a hemogram or PCV, total protein. Which you're already, doing as a pre-surgical or pre-exam blood work. If you're seeing any urinating out of the box or bloody urine, you could do a urinalysis. But otherwise, there's a ton of different tests you could do based on symptoms. So for our spay, the drugs that we used were so to induce anesthesia, we gave propofol. And the pre-medication that we gave was HAM, so that's hydromorphone, atropine, and midazolam. So the hydromorphone is going to be a pain medication, and the atropine is going to keep the heart rate at a stable rate, and then the midazolam is going to, as a sedative, to help keep the dog under a nice maintained state of anesthesia. So alright, so to maintain the anesthesia, what we use is the isoflurane. So otherwise, the main goal is to have a good analgesic effect and to make sure that the dog's going to be comfortable during and after anesthesia. So afterwards, they get to go home with an NSAID. We usually use Deramax or Rimadyl just to keep the inflammation down and to help with some pain afterwards too. Otherwise, that is the general spay medication list. So we are going to log the controlled substance, the buprenorphine that we did for Autumn Douglas's dental. So what you want to do is get the correct binder of controlled substances. So as you can see, they are made to where you can't take any pages out. So you just want to make sure you're in the right folder. So buprenorphine, go to the current page. And so if you look, what we did was we wrote the date, the patient, Autumn Douglas. It's a canine. Dr. Pillsbury was the one administering the drug. The previous valence is 16.75. We had given 0.5. So you subtract 0.5 and it's the remaining is now 16.25. So this will make it to where there's no issues with the DEA and that you have all your logs straight. To explain the anesthesia machine, so first of all, this is a rebreathing tube, so it's got the one tube inside of the other. So this is the inspiratory part where you connect it. This is the inspiratory pressure. go over the monitor. Do our gastric into Brittany. She's gonna help. IV injection right now. Okay, so we're gonna get I'm going to palpate